The moment a patient's heart stops beating and they're pronounced dead, hospitals shift into a protocol that families rarely understand and staff rarely explain. What happens to your body in those first minutes and hours after death is a clinical, sometimes chaotic process that contradicts what people imagine. And most families never see what their loved one's body goes through before it's released to the funeral home. The instant you die, monitors are silenced. The urgent beeping stops. The room that was full of urgency and intervention becomes still, but your body doesn't rest peacefully. Immediate procedures begin that are clinical, necessary, and often deeply disturbing if families witness them without preparation or understanding. The first thing that happens is certification of death. A physician or nurse practitioner must officially confirm you're dead, verify there's no pulse, no respiration, no response to stimuli. They come to your bedside with a stethoscope, listen to your chest for a full minute, check your pupil response to light, assess for any signs of life. This takes several minutes. They're not being slow. They're being legally thorough because they're signing a document that declares you dead, and they need to be absolutely certain before making it official. Your body begins immediate changes the moment your heart stops. Blood stops circulating and begins pooling in the lowest parts of your body, creating purple-red discoloration called livor mortis. Your skin cools rapidly as your body temperature drops toward room temperature. Your muscles begin to stiffen, a process called rigor mortis that starts within 2 to 6 hours but begins immediately at a cellular level. Sometimes your eyes remain open or half open. Your mouth might fall open. Your bowel and bladder muscles relax, and sometimes involuntary release happens as your body completely loses control. The second thing is that all lines and tubes require immediate decisions. If you're an organ donor, everything stays in place, because organs need continued blood flow to remain viable for transplantation. If you're not an organ donor, the question becomes, do we remove the breathing tube, the central line, the urinary catheter, all the IV lines? Different hospitals have different protocols. Some remove everything immediately. Some leave certain things in. Some wait for family to see you before removing them. This decision profoundly affects how your body looks and how your family experiences their first viewing. Here's what's deeply disturbing for families. If they want to see you immediately after death, you might still have the breathing tube in your throat, the central line in your neck, the urinary catheter visible. Your body looks like you're still on life support even though you're dead. Or staff removes everything, and there are holes, puncture marks, bruises, and clear evidence of medical interventions covering your body. Families are sometimes not warned about this, and seeing their loved one covered in evidence of medical care can be profoundly traumatic. The third thing is rapid assessment for organ and tissue donation. If you're registered as an organ donor, staff immediately starts contacting the organ procurement organization. Time is absolutely critical. Organs can only survive outside a body for specific time frames. Hearts must be transplanted within 4 to 6 hours, livers within 8 to 12 hours, kidneys within 24 to 36 hours. If organ donation will happen, your body will be kept on life support machines even though you've been pronounced dead. You'll be kept artificially perfused to maintain organ viability while surgeons are assembled and recipients are located. Here's what families don't understand. Your body might be on a ventilator, on medications keeping your heart beating, being artificially kept alive for organ retrieval even though you've been declared dead. Your family might desperately want to spend time with you, but you're being prepped for surgery instead. They might not be allowed in the room because preparation for organ recovery is underway. The organ procurement team works quickly and efficiently, and family presence slows them down significantly. The fourth thing is family notification. Someone, a nurse, social worker, or doctor, must tell your family you're dead. This is done as soon as certification is complete, but sometimes families are in the waiting room thinking you're stable when they're brought to a quiet room and told you've died. The delivery of this news varies dramatically. Some hospitals have trained staff who specialize in delivering difficult news with compassion and patience. Some staff just tell you directly and leave you to process the shock alone. Here's what's cruel about this moment. If your family was told to wait in the waiting room because there's nothing they can do, they often don't understand you were actively dying or had just died. They might feel angry that they weren't called sooner, that they weren't there at the exact moment of death, that nobody was in the room with you when you died. They don't know that sometimes nobody can be in the room. Sometimes the medical team is performing resuscitation procedures. Sometimes equipment is in the way. Sometimes there's literally no time to coordinate family presence in the chaos of a dying patient. The fifth thing is that your body begins being treated as evidence in any unexpected death. In any death that's sudden, unexpected, or occurs outside a hospital, or if cause of death is unclear, an autopsy might be ordered by a medical examiner or coroner. An autopsy is a surgical examination of your body to determine the actual cause of death. Your body is taken to the medical examiner's or coroner's office. A pathologist makes a large incision from shoulder to shoulder, down your sternum, and to your groin, examining all your organs, taking samples, sometimes removing entire organs for further examination. Here's what families don't realize until it's too late. If an autopsy is ordered, your body will be significantly altered. It will be cut open extensively. Your internal organs will be removed and examined. Some organs might be retained for further testing. Your body will be sutured back together, but the internal damage is done. If your family wants an open casket funeral, the funeral home has to do significant additional work to make you look presentable after an autopsy has been performed. If you're learning what really happens to your body after death, hit subscribe. We're exposing the procedures and protocols that hospitals never fully explain to grieving families. The sixth thing is your body is moved to the morgue or designated storage area. If organ donation isn't happening, your body is moved relatively quickly, usually within a few hours. If organ donation is happening, your body stays in the surgical suite for the organ retrieval process, which can take 4 to 8 hours depending on which organs are being removed. Here's what's unsettling. Your body is being handled and worked on by staff you'll never know, in rooms your family will never see. If organ donation is happening, surgeons are opening your body in an operating room, removing your organs, and essentially harvesting tissue like an agricultural operation. It's necessary and life-saving for organ recipients, but it's profoundly invasive, and your family doesn't witness it or fully understand the extent of the surgical intervention. The seventh thing is extensive paperwork begins immediately. Death certificates must be completed accurately. Medical records must be finalized. Cause of death must be documented correctly. If there's any question about how you died, additional investigation might be required by authorities. Your social security number is flagged in government systems. Insurance companies are notified. Your medical provider's records are officially closed. Here's what creates real problems for grieving families. If your death was unexpected, these processes take considerable time. Your family might not be able to get an official death certificate for days or weeks while investigations are completed. Without a death certificate, they can't access bank accounts, notify employers, settle estates, apply for life insurance benefits, or make funeral arrangements. They're stuck in bureaucratic limbo, unable to move forward with practical matters while processing grief. The eighth thing is your personal belongings are cataloged and handled according to hospital protocol. Any personal items, your wedding ring, watch, glasses, dentures, hearing aids, must be documented and returned to your family or held safely. Sometimes items go missing in the system. Sometimes families are charged storage fees for holding belongings. Sometimes there are disputes about what you were wearing or what you had with you when you died. Here's the frustration for families. They often desperately want the clothes their loved one died in, thinking it's their last connection. Hospitals sometimes dispose of contaminated clothing as biohazard waste if they're covered with blood or bodily fluids. Other times, clothes are saved, but smell like hospital and death. Families sometimes want every small item back, every piece of jewelry, every document from your wallet, every personal effect. Inventory becomes complicated, and sometimes items are genuinely lost in the system between hospital, morgue, and funeral home. What hospitals do to your body the moment you die is transition it from patient to medical case to remains requiring disposition. Your body might be kept artificially alive for organ donation, moved to a morgue, taken to autopsy, or placed on a funeral home's table being embalmed. Different procedures happen simultaneously in different locations, and your family often has no idea where you are or what's being done to you. Make decisions about your body before death occurs, because after you die, those decisions happen quickly and sometimes without the compassion or consideration they deserve.